Overall, when we did the capacity assessment for those 4 areas, you can see the score was out of 3, and you can see policy alignment, leadership support, and partnership and collaboration, the overall score and consensus score, because what we did is that we divided the team into 2. We gave them the tool and they assessed the same area. Apparently, some of the areas they agreed in terms of the scoring, there were others that had differences, and we had a point of discussing why different divergent scores, and we ended up with a consensus score. So what you are seeing here was the consensus scores that were agreed by the 2 groups. And staffing and skill mix, we had 1.8, and project management. So the overall score in terms of the current status of the Hptu was 2.1, and that is what is projected there in terms of the scores for every area. So that then, because you are lucky you are the first ones who have started.
Once we do that, and we are already there in that facility, we are able now, we can say this is our office, and we know what we are supposed to do. And through the Hptu, we are able even to realize that we can produce our own detergents. This morning, we are here looking at our Hptu, that's Healthy Product Technology Unit. And we have a team here from Ugavi, Afya Ugavi, who are actually conducting an assessment on how far we've managed to undertake Hptu as Turkana County government. And I'm glad after joining the teams to learn and also to appreciate what the consultants have done. We realize that there are some areas, there are some gray areas that we need to work on as a county government, Ministry of Health. And we have a lot of give and takes when we look at staff mix issues, whereby we need to do a lot of induction with our staff. We need to retrain our staff who are handling Hptus, because it's a specialized unit. Being a specialized unit, it requires us to have more, to impact more knowledge into our staff so that they can be able to undertake that docket. And as a government, we are willing to do that. We are looking forward to engaging our staff and to retrain our staff, because we want the best out of them. They are already doing their job, but we want the best out of them based on the findings from this assessment that has just been going on. We are also looking at strengthening our partnership with partners, because as a Minister of Health, we already have a health coordinator, partner coordinator, who is undertaking this exercise, and a lot of efforts has been put here. We now have a matrix where we can be able to tell who are our partners and where they are working at any given time, and the planning is being done on a weekly basis. But now we want to make sure that the areas as pertains to Hptus is being captured very well, so that we can also engage other partners in this area. With Hptus now coming on board, strongly coming on board, we can be able now to foretell what we have in our warehouse in terms of our drug supplies, and we can be able now to be able to support even sub-counties from the HQ. And we look forward to more engagement of this nature. We also look forward that mapping out who are the partners who are involved in the Hptus, we can be able to bridge the gap, the funding gap, the deficit gap that we already see. Because right now, as a county government, we need about 750 million to operationalize the Hptu unit. And we only have a budget of about 250 million. That means that there's a lot of work that we need to do. But how can we be able to achieve this? We look into working with our partners to see what they have already in their stock, so that we can be able now to actualize what they have and make sure that we can get the value of what they have and then put on our budgets, so that we can be able to see where the deficit comes from. We really appreciate the work done by our partners. And last but not least, it's on the issue of to improve on how we engage. We need really to improve our engagement with our partners. And we really appreciate what partners are doing in Turkana County, especially in the Ministry of Health. We have seen a lot, and they have supported us with a lot of equipment. They have supported us in terms of drugs, and we look forward to that engagement. So as a county government, from the Ministry of Health, we welcome our partners, and we want to work together with them to realize that and strengthen the Hptu unit.